Assalamualaikum warahmatullahi wabarakatuh. I am NURSYAMIM FADZLIN binti Muhammad RAFI. I will present about the symptoms and causes of diabetes. First of all, we need to know what is diabetes. Diabetes is a chronic disease characterized by high levels of sugar in the blood. There are two types of diabetes, which are type 1 diabetes and type 2 diabetes. Although the symptoms of type 1 and type 2 diabetes are similar, they present in very different ways. So here are some of the symptoms of diabetes. For the first one is weight loss. Even though you might eat and drink a lot, you may still lose weight because you absorb the sugars you are eating, and your body may be breaking down fat for energy. And the second one is frequent urination. This is happen because of the level of your blood is too high. The third one is increased thirst. Because you urinating more often, you may feel dehydrated and thirstier than usual. Next is increased hunger. When you have high blood sugar levels, the body loses sugar through the urine, so you don't get enough calories. Because you absorbing fewer calories, you may feel extra hungry. Next is blurry vision. High levels of blood sugar can affect your ability to see by causing the lens inside the eye to swell, which can result in temporary blurring of eyesight. The next symptom is slow healing wound. People with uncontrolled diabetes may develop poor circulation. As circulation slows down, blood moves more slowly, which makes it more difficult for the body to deliver nutrients to wounds. And the last one is numbness or tingling in hands or feet. High blood sugar can cause diabetic neuropathy, which damages the nerve that sends signals from your hand and feet. Diabetic neuropathy can cause numbness or tingling in your fingers, toes, hands, and feet. Next, I will proceed to the causes of diabetes. For the type 1 diabetes, your body does not produce insulin. And for the type 2 diabetes, which is the common type, your body produces insulin but not used efficiently. Insulin is a hormone that helps the glucose get into your cells to give them energy. Without enough insulin, the glucose stays in your blood. Type 1 diabetes is caused by a malfunctioning immune system, which is your body's defense against infection. When you have type 1, the immune system attacks and destroys the cells that make insulin in the pancreas. Medical research seems to indicate that type 1 diabetes is caused by family genes or environmental factors such as viruses. Next, type 2 diabetes occurs due to a number of factors including genes, lifestyle choices, and diet. Type 2 usually begins with a condition known as insulin resistance, as your muscles, liver, and cells do not use insulin as they should. This type of diabetes usually develops in overweight and obese individuals. Here you can see the differences between type 1 and type 2 diabetes. For type 1 diabetes, you can see there is no insulin produced. For type 2 diabetes, the insulin is produced but the cells do not respond to insulin.
Assalamualaikum warahmatullahi wabarakatuh. My name is AMIZATUL from BINTI ZAHARUDDIN, and I will proceed the presentation with how to prevent the diabetes. Firstly, currently, no one knows how to prevent type 1 diabetes, but it can manage by following a doctor recommendation for living a healthy lifestyle, managing blood sugars, and getting regular health checkup. You can make better decision about your diabetes. You need to learn the skill how to take care of yourself such as healthy and always check blood sugar. Next, you need to do regular exercise about 30 minutes a day for at least 5 days a week with different level of intensity. Just activity you enjoy while exercise as you will do them every day. Exercise is so important because it can help in manage weight, reduce blood glucose, and may also improve blood pressure and cholesterol. Next, you need to quit smoking and limit alcohol intake. It's because both can increase risk of diabetes. By taking too much alcohol, it can lead to weight gain and may increase your blood pressure. For men, it is recommended to have no more than 2 drinks, while for women, no more than 1 drink. But if you can do so, quit both. Next, have a healthy, balanced diet. For example, you can choose healthy fats. So it can help lower your risk of diabetes, such or life or. You need to skip um, red and processed meats. Also, you can eat more high fiber foods. Other than that, it's so important focus on eat plant foods. You need to go veggie more often as you can eat lots of fruits and vegetables. So it can keep blood sugar in check. For midday snack, you can look for plant foods for both digest slowly and higher in calcium, making better sugar blocker due to less sugar and more fiber. Next, control blood pressure by do regular exercise and eat healthy. By control blood pressure, it can reduce high blood pressure which can lead to trouble. Last but not least, manage your weight. You can choose leaner protein, for example, try vegetarian protein alternatives such as soy products. Next, choose lower fat dairy such as milk and yogurt. Last but not least, limit added fat in recipe. For example, choose majorly labeled non-trans fats and avoid tropical oils like coconut oil. It can help improve your body ability to effectively respond to insulin resistance. That is all from me. Thank you.
Assalamualaikum, my name is MASHITAH binti OMAR and I will continue with complications of diabetes. The first complication is nerve damage or known as diabetic neuropathy. It is divided into two, which is peripheral and autonomic. Peripheral neuropathy mostly affect nerves and increase sensitivity. It causes weakness, pain and numbness in feet and hands. People who have peripheral neuropathy usually get very cold and hot easily, and they usually have a very poor stability. For autonomic neuropathy, it affects the nerves that control body system. It is usually caused by the abnormal protein buildup called amyloidosis in organ. It can lead to the paralysis of bladder, which means that bladder cannot function normally. The symptoms will be dizziness, constipation, and sometimes heartburn. For kidney damage, it is a kidney failure or lose its ability to filter out waste products. It is caused by the high level of sugars that cause kidney to filter too much blood, that cause the blood vessels in our kidney to be damaged. The symptoms will be low appetite and poor sleep, and sometimes for people who have kidney failure, they will experience swelling in face, feet and hands. There is no cure at this moment, but treatment can be done to stop or prevent the progression of the disease. Doctor usually will recommend a good diet or medication to control the level of sugars in our blood. The last one is eye complication, or we call it as diabetic retinopathy. The first one will be glaucoma. Glaucoma are caused by the pressure that pinch the blood vessels in the eye, which then cause the damage of both retina and eye nerves. People who have glaucoma usually will lose their vision slowly, and they will see a very bright ring around the light. It can be treated using a prescription eye drop that can prevent or stop or minimize the pressure on our eye nerve. The last one will be cataract. Cataract is the condition where lens was blocked by a white blocking or clouds. It is caused by the excess sugar of a diabetes. For a serious cases, it can lead to blindness, and sometimes people need to have a surgery to remove the clouded lens to have a better vision. And people who have diabetes have a very high risk to get cataract.
Assalamualaikum warahmatullahi wabarakatuh. My name is w.b.t SABRI and I will present about mechanism of rising blood sugar level. Blood glucose regulation is the process by which the level of blood glucose are maintained by the body within a narrow range. This blood regulation is referred to as glucose homeostasis. The pancreas secrete hormones and they are primarily responsible to regulate glucose levels in blood. The hormones are insulin and glucagon. When blood glucose is too high, the pancreas secretes more insulin. When blood glucose levels drop, the pancreas releases glucagon to raise them. This balance helps provide sufficient energy to the cells while preventing the nerve damage that can result from consistently high levels of blood glucose. This is the diagram of homeostasis for blood glucose level. When blood glucose rises, cells in the pancreas release insulin, causing the body to absorb glucose from the blood and lowering the blood glucose level to normal. Response to an increase in blood glucose. During digestion, your body breaks down carbohydrates from foods into various sugar molecules. One of these sugar molecules is glucose, which is the main energy source for the body. Glucose is absorbed directly into the bloodstream. When the glucose level in the blood rises, it signals the pancreas to release insulin to unlock the cell so that glucose can enter and provide the fuel of the cell need to function properly. This process lowers the amount of glucose in the bloodstream and prevents it from reaching dangerously high levels. As the blood glucose level returns to normal, so does the secretion of insulin from the pancreas. The control of blood glucose by insulin is a good example of a negative feedback mechanism. When blood glucose rises, receptors in the body sense a change. In turn, the pancreas secretes insulin into the blood, effectively lowering blood glucose levels. Once blood glucose levels reach homeostasis, the pancreas stops releasing insulin. What happens if blood glucose regulation fails? Hyperglycemia will occur. Hyperglycemia refers to high levels of glucose in the blood. High blood glucose happens when the body has too little insulin or when the body cannot use insulin properly. High blood glucose or hyperglycemia can cause major heart complications in people with diabetes over time. Several factors can contribute to hyperglycemia, including eating more carbohydrates than normal and being less physically active than normal. Regular blood sugar testing is crucial for people with diabetes because many people do not feel the symptoms of high blood sugar. That's all from me. Thank you.
Assalamualaikum warahmatullahi wabarakatuh. My name is Intan FAIZANI binti RIDWAN. I will explain about mechanism in blood glucose regulation. Regulation of glucose in the body is done constantly through each minute of the day. Normal blood glucose level should be 90 mg per 100 milliliter in order to supply cell of the body with its required energy. Homeostatic control involves three functional components. First, receptor. Second, control center in brain. And third is effector. Blood glucose level. When blood glucose level is declined because of you are fasting or skipping meal, it will stimulate the pancreas. The alpha cell of the pancreas stimulate to release a type of hormone that called glucagon. This glucagon will stimulate the livers to break down the excess of glycogen and release glucose. The glucose will go into the bloodstream and the blood glucose level will increase. So, it will become normal. So, stimulus glucagon release diminishes. What happens if blood glucose regulation is low? When the condition where the concentration of the glucose in the blood is too low, it will call as hypoglycemia. Hypoglycemia occurs when the blood glucose is about 72 mg per deciliter. Because of too high a dose of medication, so it will affect of the somatic cell. Somatic cells are stuffed of glucose and brain cells may be damaged. The main symptoms of hypoglycemia are sweating and feeling dizzy. So that's all from me. This is here our reference. Thank you.